as I said before, not being a big doctor guy, I really knew nothing about any of them or this hospital. But this is where we came from the word of other people. Said if you want the best care, this is where you should be. You know, I ended up when we got to the stem cell part of working with Dr. Taylor, and he's been great. I think the best part was while I was going through chemotherapy, he took the time to come in, sit down and say, hey, you know, a couple months down the road, we're going to get to know each other, and my role in this is this. And then he laid out the entire plan and how often he's done it, you know, how successful it's been. I mean, there's no guarantees with anything, but we felt very comfortable. Once you're going through chemotherapy and you have a PET scan and it says there's no more cancer in you, there is a part of your mind that says, okay, we did it. But talking to Dr. Taylor, he said, you may have done it, but remember, if we want to try and get rid of this thing and not have it come back, or at least expand the amount of time before it would rear its ugly head again, the stem cell transplants where we want to go, and that was convincing. Between him, his team of nurses, the nurses again in the cancer center, the Lombardi clinic, they all make it convenient for you. And I mean, we received personalized cards. We've made friends that we've got forever, you know, beyond a nurse-patient or a doctor-patient relationship. You know, we took even at the doctor's persistence, we went and got a second opinion from a doctor at a Madison hospital. And we were given the names by the oncologists here. And they said, you know, if you want to, this fella knows everything there is to know about this cancer. Why don't you go and talk to him and see what he has to say? And when we talked to him, we were driving home from Madison, and that's when we had this discussion. It said, let's do everything in our power. We believe faith-wise that, you know, God's made everybody, including doctors, including, you know, the miracles of modern medicine. And I think it's foolish to say, you know, I'm going to sit home and let God take care of this. I believe the doctors and the nurses are a miracle. And therefore, why would you not take advantage of that miracle? And that's the decision we made. The biggest part of our faith is we know I'm confident in where I'm going to end up someday, whether that's a week from now or hopefully 40 years from now. So we're okay with that. I think it came more down to trusting the physician and knowing that I'm an expert in something, as are you. So is he. And I trust in his expertise, and so far, you know, it's paid off. I mean, I feel great, and I'm looking forward to, I got a lot of stuff to do still, and I do it a little quicker. Try not to let days go by and things of that sort, because it does thump a little bit of reality into you. And there may be 40 or 50 more years. That'd be fabulous, but there may not. And it makes you think about all that stuff and do the most with what you got now. I'm actually the assistant pastor at my church. So, you know, I have a strong faith, but to have the people around me see you get something like this brings a lot of questions to their mind. Like, you know, why him? Why Ken? You know, from what I see, you know, he takes good care of his family. He's good to others. You know, my job is, you know, with an organization that serves people every day. And they say, well, why you? And I don't think I've ever really said that. We all get stuff. We all have tough times. We all have to deal with things. This is mine and my family's. And how we dealt with it is how you're measured, and what you do with it. And so we did everything we could in our power, and then listened to some very intelligent people around us and said, let's prove this thing wrong. Let's let's be a shining example for someone, and positive attitude. I had that before. I still have it, and that's the way I am. That's the way we are, and we stayed that way. Didn't change. You have your tough moments. You know, you have your. Do you have a why me moment? You know, I think everybody has that, but they're quick and they're turned around into, now what do I do with this? And you still are kind to people. You still do good things, and this is just part of the road.